Maxigra tablets is a treatment for erectile dysfunction. The active ingredient of the drug is sildenafil. With sexual stimulation, it restores impaired erectile function by increasing blood flow to the penis. Indications: treatment of erectile dysfunction characterized by an inability to achieve or maintain an erection of the penis sufficient for satisfactory intercourse. The drug is effective only with sexual stimulation. How to use: inside about 1 hour before the planned sexual activity. The maximum recommended frequency of use is once a day. A single dose for adults 50 mg 1 time per day. Based on efficacy and tolerability, the dose may be increased to 100 mg or reduced to 25 mg. The maximum single dose is 100 mg. When taking sildenafil with a fatty meal, the onset of its action may be delayed compared to when taken on an empty stomach. Dose adjustment is not required in elderly patients. With mild to moderate renal failure, dose adjustment is not required. With severe renal failure, the dose of sildenafil should be reduced to 25 mg. Based on efficacy and tolerability, the dose may be increased to 50 mg and 100 mg. In case of impaired liver function, the dose of the drug should be reduced to 25 mg. Based on efficacy and tolerability, the dose may be increased to 50 mg and 100 mg. To minimize the possibility of developing orthostatic hypotension in patients taking alpha blockers, treatment with sildenafil should be started after stabilization of hemodynamics in these patients. In addition, the advisability of prescribing sildenafil at an initial dose of 25 mg should be considered. Contraindications: hypersensitivity to sildenafil or to any other component of the drug. Use in patients receiving constantly or intermittently nitric oxide donators, organic nitrates, or nitrates in any form, since sildenafil enhances the hypertensive effect of nitrates. Special instructions: before prescribing treatment, it is necessary to collect a medical history and conduct a physical examination in order to diagnose erectile dysfunction and determine the possible causes of its development. Erectile dysfunction medication should be used with caution in patients with anatomical deformity of the penis, angulation, cavernous fibrosis, Peyronie's disease, or in patients with risk factors for priapism. If an erection persists for more than 8 hours, you should immediately seek medical help. If priapism therapy is not carried out in a timely manner, this can lead to damage to the tissue of the penis and irreversible loss of potency. Drugs intended for the treatment of erectile dysfunction should not be prescribed to men for whom sexual activity is undesirable. Side effects: immune system disorders, infrequently, hypersensitivity reaction, nervous system disorders, very often, headache, often, dizziness, infrequently hypophysia, drowsiness, rarely stroke, fainting, frequency unknown, intracerebral hemorrhage, transient ischemic attack, convulsions including recurrent. On the part of the organ of vision, visual impairment, change in color perception, infrequently conjunctivitis, impaired lacrimation, eye pain, photophobia, photopsia, redness of the eyes, scleral injections, changes in the brightness or light perception, frequency unknown, anterior ischemic neuropathy of the optic nerve of non-inflammatory origin, retinal vascular occlusion, visual field defects. On the part of the organ of hearing and labyrinth disorders, infrequently, vertigo, tinnitus, rarely deafness. From the side of the cardiovascular system, often, flushing of blood to the face. Infrequently, palpitations, tachycardia, rarely arterial hypertension, myocardial infarction, atrial fibrillation, frequency unknown ventricular arrhythmia, unstable angina pectoris, sudden cardiac death, respiratory, thoracic, and mediastinal disorders, often nasal congestion, rarely nosebleeds. Gastrointestinal disorders, often dyspepsia, infrequently, vomiting, nausea, dry mouth. Liver and biliary tract disorders, frequency unknown, hepatotoxicity, liver damage and increased transaminase levels. Skin and some cutaneous tissue disorders, infrequently, skin rash, the frequency is unknown, Stevens-Johnson syndrome, toxic epidermal necrolysis. Musculoskeletal and connective tissue disorders, infrequently, myalgia. On the part of the genital organs and the mammary gland. Infrequently, hematospermia, bleeding from the penis, frequency unknown, priapism, prolonged erection, general disorders and disorders at the injection site, rarely chest pain, fatigue.